Bart's been a part of our family for almost 13 years. The kids love him to death. He's a little quirky. Odd things frighten him. Staircases, heat vents, big winds. That's kind of what makes him endearing. Bart had actually had a bath just a couple of weeks before I noticed anything, and I knew that at that time there was really nothing unusual about him. And about 2 weeks later, I was actually just sitting on my sofa and he walked by and I noticed a lump on his leg.
The soft tissue sarcoma is a very common cancer that we see primarily in dogs. We can also see it in cats. And it typically arises on the outside of the body. So the skin or the tissue under the skin that we call the subcutaneous tissue.
Well, Bart was 10 years old at the time of his diagnosis. And it meant a family discussion, quite honestly, as to what do we really think was going to be best for Bart and the family.
The unfortunate thing about the soft tissue sarcoma is as it grows, it will grow to the point where the skin overlying the tumor splits and it becomes a terrible ulcerated wound. So our goal with these tumors is to identify them early so that they can be completely surgically removed and cured in most cases. So if it's on an extremity, on a limb, we'd absolutely have the option for amputating the patient's limb, but not every patient is going to be a good candidate for amputation.
And I think it's very difficult for a 10-year-old dog of his size to deal with amputation of a limb. And obviously the concern would be for the long-term effects on his other joints.
So we looked at a treatment called radiation therapy. Radiation is essentially a beam of energy that we deliver to just one specific part of the body. It doesn't treat anything else, just the area where the beam of energy is directed.
The fact that we were able to save his leg is the best thing about it. And I think he's happier about our decision. I am a veterinarian, and the reason that I refer cases to Dr. Elmsley and why I chose Dr. Elmsley to be Bart's cancer specialist is because that she has a realistic approach to veterinary cancer treatment, and she's got a great track record.
Without the radiation therapy and without amputation, he wouldn't have been here today.